Come in.
Hi, Ms. Schmidt. How are you today?
I'm good. How are you?
Good. My name is Kenzie. I'm a PW nursing student, and I'll be assisting the nurse today.
Okay.
I'm going to wash my hands really quick, and I'm going to check your ID band. Can you repeat your name and date of birth?
Lauren Schmidt, 11/2/2000.
Good. And what would you like to be called today?
Lauren.
Good. I noticed that you don't have an allergy band. Do you have any allergies to food or medications?
No.
Okay, good. Patient is a 19-year-old Caucasian female, appears stated age, no signs of distress, facial symmetry is intact. Her speech is clear. She has a really erect posture, and she has an athletic build with no signs of malnutrition. Her dress is clean. She's very well kempt, and her gait is smooth and well coordinated. So what we're going to do for our neurological exam is that I'm going to start with a few questions, and I just want you to answer to the best of your ability. So
Okay.
the first one is, can you repeat your date of birth for me?
11/2/2000.
Good. And can you tell me where you are right now?
The doctor's office.
Good. Can you tell me why you're here?
For a checkup.
Good. And can you tell me what month and year we're in?
September of 2020.
Good. Patient is alert-oriented times 4. Now I'm going to ask you some memory questions, and I just want you to answer the best of your ability again.
Okay.
The first one is, what did you have for lunch today?
I had chicken.
Good. And where were you when 9/11 occurred?
I was a baby.
Good. And now I'm going to give you 3 words, and I want you to repeat them back to me now, and I'm going to ask you about them later. So the words are cat, ball, and truck.
Cat, ball, truck.
Good. So patient, their remote and recent memory are both intact. Now I'm going to move to judgment. So what would you do if you saw an old lady crossing the road?
I would help her get across.
Good. Judgment is intact. What does it mean when I say that it's raining cats and dogs?
It means that it's raining really hard.
Good. Abstract thinking is intact. Who is the president of the United States?
Donald Trump.
Good. General knowledge is intact. Now I'm going to give you a serial calculation, and I want you to start at 10 and count backwards to 0 by 2s.
10, 8, 6, 4, 2, 0.
Good. Patient's able to do simple serial calculations. Next, we're going to do some sensory tests. So the first one is, you're going to put your hand out like this. I'm going to place an item in your hand. You're going to close your eyes, and you're going to tell me which item you feel.
Okay. Fingernail clippers.
Good. The next thing that we're going to do is, I'm going to draw a letter in your hand, and you're going to tell me which one it is with your eyes closed.
L.
Good. The next thing we're going to do is sharp and dull. So I'm going to have you pull your sleeve up, and I'm going to touch you with either the sharp or dull side. You're going to tell me which side it is with your eyes closed. Ready?
Okay. Dull, sharp, dull, sharp.
Good. Now the last one is vibratory. So I'm going to strike my tuning fork. You're going to hold your hand out like this, and I'm going to place it over your joint. You're going to tell me when you can't feel it anymore.
Okay. Okay.
Good. Okay, so patient's diagnosis, graphesthesia, vibratory sense, and sharp and dull senses are all intact. So next we're going to go to proprioception. So I'm going to have you hold your hand out like this. I'm just going to move your finger either up or down, and you're going to tell me which way I moved it with your eyes closed.
Okay. Up, down.
Good. Now I'm going to do the same thing with your toe.
Okay.
Just relax for me.
Up, down.
Good. Patient's proprioception is intact. Now we're going to move to some cerebellum functions. So the first one I want you to do is repeat after me. You're just going to touch your thumb to all your fingers and reverse. Good. And then next what I want you to do is that you're going to put your hands on your thighs, and then you're going to flip them over and then flip them back again. Good, good. Okay, and the next one is, you're going to touch your nose and then touch my finger, and I'm going to move my finger around. You always touch your nose after you touch my finger. Good. Good job. Okay, and the last one for this one is heel the shin. So what you're going to do is, you're going to take your heel and you're going to rub down your shin. Good. Okay, patient's cerebellar functions are all intact. So now I'm going to do your reflexes. So I'm going to have you pull up your sleeve. Good. I'm just going to place my middle finger on your tendon. You're going to flex for me. Good, good. So what I'm going to do is, I'm just going to strike my finger, and then you'll feel a reflex in your bicep. Good. Okay, now I'm going to do your patellar reflex. So you're just going to pull up your pant leg for me. Good. And just going to feel around. It's going to be right below your kneecap. Good. Okay. And then you're just going to feel a little pressure. Good. Okay. And now I am going to test your superficial reflex on your foot. So what I'm going to do is you're just going to feel a little tickle on the bottom of your foot. Good. All reflexes are 2+, which is normal, and there's no signs of the Babinski reflex. So now we are going to test your gait and coordination. So I'm going to have you stand right here, and you're just going to walk normally to the side of the room. Good. Now you're going to walk back like you're on a tightrope. Good. Now you're just going to stand here with your arms out like this. You're going to close your eyes and you're just going to balance for me. Good. You can sit down now. Gait is smooth and well coordinated, and there's a negative Romberg sign. So now we are going to move to our cranial nerves. So the first one is the olfactory nerve. So what I'm going to do is I'm going to apply a scent to your nose, and you're going to close your eyes and you're going to tell me what you smell.
Okay. Coffee.
Good. Okay. Cranial nerve number 1, the olfactory nerve is intact. So now we're going to move to our eye test. So the first one I want you to do is I want you to stand about right here, and you're going to look at the Snellen chart over here, and what you're going to do is you're going to read the smallest line that you can read, and you're going to tell me which line you're going to read before you read it.
Okay, I'll read 6.
Okay.
E, D, F, C, Z, P.
Okay, good job. You can sit down now. Okay. So now I'm just going to test your nearsighted vision. So what I'm going to have you do is I'm going to have you read me the sentence.
The cat jumped over the table.
Good job. Now, what we're going to do is I'm going to test your peripheral vision. So I'm going to put my fingers back here, and you're going to tell me when you can see them.
Okay.
Good. Okay. The next test, also, I wanted to mention that there are no signs of lid lag. Now I'm going to test your pupils. So I want you to look at my ear and not look directly in the light, or else it will hurt your pupils. Good. Pupils equally react to accommodate light. So now I want you to follow my pen with just your eyes, and that's it. Good. Good. And now can you look down at the middle of the floor with just your eyes? Good. Patient's cranial nerves, number 2, the optic nerve, number 3, the oculomotor nerve, number 4, the trochlear nerve, and number 6, the abducens nerve, are all intact. And I forgot to mention that your cardinal fields of gaze from the movements are all intact too. So now I'm going to move to cranial nerve number 5, which is the trigeminal nerve. And this one, I'm just going to place my hands on your face, and you're just going to clench your jaw for me. Good. Clench again. Good. Muscles of mastication are intact. Now I'm going to test your facial sensation. So I'm just going to have you close your eyes, and I'm going to touch your face with this Q-tip, and you're going to tell me where you felt it. Good. 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 Okay, and with this cranial nerve is also the corneal reflex, which we're not assessing right now, but basically I would put a cotton on your eye, and your eye will have a reflex to that. So cranial nerve number 5, the trigeminal nerve, is intact. So now we move to cranial nerve number 7, which is the facial nerve. So can I have you smile for me? Good. Now frown, puff out your cheeks. Good. Now, the anterior 2/3 of your tongue would sense if you ate something either sweet or sour, and it would tell you which one it was if you ate it. And then I would give you some spicy foods to induce tear production. And then I would have you place a cracker on your mouth, and it would induce saliva production into that cracker. So with all this being said, your facial nerve number 7 is intact. Now I'm going to move to cranial nerve number 8, the vestibulocochlear / acoustic nerve. So what I'm going to do is I'm going to strike my tuning fork and then place it on top of your head, and you're gonna tell me when you no longer hear it anymore. Okay?
Okay.
Good. Did you hear it more on one side, or was it just both sides?
It was even.
Good. Okay, so that was the Weber test, so it's intact. Now I'm going to strike my tuning fork and then place it behind your ear, and then you're going to tell me when you no longer hear it, and then I'm going to put it in front of your ear, and then you're going to tell me if you do hear it. So just raise your hand for both of those.
Okay.
Ready? Good. This is the Renee test, and it is intact. Air conduction is greater than bone conduction. So now what we're going to do is, we already assessed your balance. So your balance is you're coordinated, you're able to balance and everything. So now we're going to do the whisper test. So what I'm going to do is I'm going to stand here and I'm just going to whisper you something and you're going to tell me what I said.
Hi, Lauren.
Good. Cranial nerve number 8, the vestibulocochlear / acoustic nerve, is intact. Now we move to cranial nerve number 9, which is the glossopharyngeal nerve. So I just want you to swallow for me. Good. Now I'm going to test your gag reflex, and all I want you to do is just gag don't hold it back. Ready? Good. Gag reflex is intact, and also with this nerve, you'll be able to taste with the posterior 1/3 of your tongue. So cranial nerve number 9, the glossopharyngeal nerve, is intact. Now we move to cranial nerve number 10, which is the vagus nerve. And with this one is speech. And your speech is clear, we've noted this already. And now I'm going to look into your mouth when you say ah and stick your tongue out.
Ah.
Good. The palate rose and your uvula is moving. And do you ever pass out from sensory overload?
No.
No? Good. That's the vasovagal response. And now we are, the cranial nerve number 10, the vagus nerve, is intact. Now we are going to move to cranial nerve number 11. So what I want you to do is just shrug your shoulders. Good. Now I want you to shrug them with my resistance. Good. Now I just want you to turn your head back and forth like this. Good job. So cranial nerve number 11, the spinal accessory nerve, is intact. Now we move to the last nerve, which is the hypoglossal nerve. And what I'm going to have you do is I'm going to have you stick out your tongue for me. Good. Now I just want you to move your tongue around for me, please. Good. Cranial nerve number 12, the glossopharyngeal nerve, is intact indeed. Okay, we've made it to the end of our assessment, and all 12 cranial nerves are intact. So I just want to thank you so much for your time and cooperation, and I want you to have a great rest of your night, and I'll see you again next time.
Okay, thank you.
Thank you so much, Lauren. Bye.
Bye.